Cool. Hey Shayne, how are you?
Yeah, good mate, good, real good. Yeah.
So thanks for coming to the Hacking Health at eHealth Expo. That's a bit of a mouthful.
It
Try to
is.
say that a few times quickly.
And coming from an 80s analog guy, it's even bloody harder, mate, I can tell you.
So Shayne, tell me about yourself. Tell me about what brought you here to the event.
Sure.
And we'll go from there.
Okay, so a basic background, I'm a country boy born in Miles. It's about 4 hours west of Brisbane here. And what brought me to the event is the idea of Indigenous health. So in my private life, I've been working in the Indigenous health space myself because I just see that the culture is going to be lost sooner or later. So we need to be able to capture the culture and keep it going forever and ever in perpetuity. So technology is one of those ways to do that. When I came to the Hacking Health, I thought, well, you know, how can I bring Indigenous culture, heritage, tradition, and put a health slant on it?
Yeah.
So, because if I'm going to assist or think that I'm assisting the Indigenous peoples, it has to be culturally appropriate. So I came up with, there's a whole lot of Indigenous games that Indigenous traditional games that Indigenous people play, and I thought, why can't we pick some of those and put a health slant on them? Simple health messages, or you know, searching for healthy foods,
Yeah.
and go from there. So that was the idea. Yeah.
So, okay, coming back to where you, Miles, right?
Yeah, correct.
How much, when you look at health and this health system,
Yeah.
I'm very conscious of a lot of people's backgrounds, where they're from, then comes up into adulthood to figure out, okay, and that becomes their background, and part of their purpose.
Yeah.
So living in that kind of region, how does that shaped in terms of some of the ideas that you brought here?
Okay, so I guess a couple of things. Coming from Miles and from a personal experience, my dad passed away from leukemia. But the travel, the distance, travelling from Miles to Brisbane to see his oncologist, or if he was really sick of a night time, mum travelling all that way, putting dad in hospital, and then, you know, midnight or 1 o'clock in the morning, she's got to find accommodation. So, you know, Benjamin Franklin's got a great saying, an ounce of prevention, a pound of cure. So, you know, that's the sort of thing that I'm looking at too, is that, you know, if these kids, if we can get them, you know, teach them to eat properly, you know, or ingrain that sort of stuff, and give them healthy choices, but in a culturally sensitive way, that could help, you know, with technology, so they don't have to travel to an oral health thing to get their teeth done, or, you know, that we're preventing that sort of thing happening, because I think the prevention rather than the cure is what I'm after. And starting at the base where your kids are, this is generational, it's going to be slow, but this is the first step.
Well, anything that's generational, anything that has a cultural sense to it.
Yeah.
When some of the conversations we were having, where you do relate that back to a personal choice.
Yes.
It's not about the health system say, hey, you have to do this. If you don't do that, then these are the consequences. It needs to be from a personal perspective. Correct. To actually move on. And when you do anything with a cultural significance, as you're saying, it is from that angle versus a clinical nature.
Absolutely, and you know, because that's the other thing is too, is when I was developing my app outside of this Hacking Health environment, one of my app developers or people or mentors that I went to, he said, "Why are you doing this?" And it was, you know, and it wasn't for the money. It's about losing the culture and losing the tradition, and that's what I'm afraid of. You know, I'm white. I haven't got an Indigenous bone in my body, but it's part of me. You know, that's the way I see it.
Well, we had Peter Laurie present yesterday, and he came back from advisory board trip into China.
Oh, yeah.
And one of the things that he mentioned to me is, your kids, so I'm Cantonese background, your kids should learn Mandarin.
Yeah.
Just purely going back through in terms of what's happening in different regions and what they're trying to do, then that cultural significance in terms of the next 30 years or the next 60 years are things that we need to put into our education system, into early childhood programs as well as we can, and games, when you start looking at prep, they're talking about game-based learning.
Yeah.
Or play-based learning.
Yeah.
So having that as part of the curriculum is a natural course.
Yeah, and certainly, you know, what we're looking at too is, you know, and this is only a development and you know, a minimum viable product, but getting the likes of well-known Indigenous Australians to have little health messages there, because kids look up to those people. Jonathan Thirsty's, Kathy Freeman's, Adam Goods, Australian of the Year 2017. So, you know, if we can make that whole community get involved, I think it'd be a lot better place.
So this finishes tomorrow.
Yep.
You'll be up on stage in front of 300, 400 odd people.
Yep.
No worries about that?
Look, you know, I've got nothing to lose and everything to gain, and that's the way I look at it. You know, I did my practice pitch a week ago.
Yep.
I come here and I did, the amount of people is just a number, so let's just give it a crack.
I love it. Give it a crack.
Yeah.
Right? So so after this, whatever happens, where do you see this going? Because you did say that you did start this outside of the event.
Yeah, absolutely. So this has been a bit of a passion of mine outside of this event, and I've even went to a lawyer and got a company set up in regard to Indigenous health or Indigenous culture, etc. I've already talked to a gentleman who was at the Myriad workshop. I've got some QUT, what we call it, contacts as well.
Yep.
Greg's given me a contact. So I just want to explore my ideas and where they're going to go. If they don't go anywhere, it doesn't matter. At least I've given it a try. I just can't sit down and earn a wage each week. I've got to. There's more to life than that. So that's where I'm at. So, and if this doesn't work, or if it does, well and good. You know? If I make a bit of money out of it, good. But if I don't, it doesn't matter. You know, it's more about the culture in this organisation.
Well, Shayne, thanks very much.
Thanks, mate.
Appreciate your time and good luck for tomorrow.
Yeah, cheers, mate. I'll need it.